Hello everyone, I will be talking about a case of Vibrio cholerae infection, and I will be highlighting only the key and important positive findings while describing the case. So let's start. A 39-year-old male resident of Pune has come to visit his uncle in a village and comes to district hospital with chief complaints of loose motion since 2 days, vomiting since 1 day, decreased urine output since 1 day. After further questioning, we get to know the frequency of stools in the last 24 hours is 6 to 8 times, with an increase in the last 12 hours, and that of emesis is 3 times. The consistency of stools is watery and with absence of blood. He has diarrhea irrespective of any oral intake, and he had consumed seafood 2 days ago. On examination, the findings are loss of skin elasticity, low blood pressure, the patient seems to be irritable and thirsty, but there is no abdominal pain. Now, what do we understand from his complaints? Diarrhea is acute in onset. Presence of emesis means it is small bowel diarrhea because it is a rare feature in large bowel diarrhea. Features of mild to moderate dehydration are present, like loss of skin elasticity, low blood pressure, decreased urine output, being irritable and thirsty. Now, why not severe dehydration? Because in case of severe dehydration, then the patient would have presented with lethargy, or he would have been unconscious, sunken eyeballs, very weak pulse. We also get some idea about the type of diarrhea, that is secretory, because he says that he is experiencing loose motions irrespective of any oral intake, and also the consistency is watery. Plus, there is positive recent travel history, and he says that he had consumed seafood 2 days ago, which means it can be a foodborne infection, might be endemic in that area. The probable diagnosis is definitely an infective etiology, most probably cholera, but we should also consider some other differentials like bacterial food poisoning due to enterotoxigenic E. coli or giardiasis. The samples which we need to collect are blood and stool. During an investigation of an epidemic, food and water which are thought to be contaminated are also collected. Vomitus is not a good sample, as the chances of isolating the organism are too less. The investigations to order: CBC, that is complete blood count, to get an idea about the hematocrit; stool microscopy, preferably under dark field illumination, to visualize the organism; and stool culture to identify the positive organism. Now, gram stain and motility examination will be necessary on the culture to further aid us in identifying the organism. Other investigations like blood urea nitrogen, serum creatinine, serum electrolytes, renal function tests, arterial blood gas analysis and ECG may be done in cases of severe dehydration and if the patient is hemodynamically unstable. Also, during epidemics, we have rapid diagnostic test kits available to speed up the entire process. The transport medium which is used for the collected stool sample is Cariblair or Venkatraman Ramakrishnan medium. If the samples can reach the laboratory in few hours, then alkaline peptone water or Monsoos medium can also be used. Media used for culture is the TCPS agar, that is thiosulfate, citrate, bile, salt, sucrose agar. The laboratory findings will show hematocrit will be increased, showing or indicating hypovolemia. Stool microscopy shows no fecal leukocytes, which indicates non-inflammatory type of diarrhea. Under dark field illumination, Vibrio shows characteristic shooting star motility or darting motility. Growth is seen in culture on TCPS agar. Gram stain confirms the presence of gram-negative coma-shaped Vibrio, and motility is seen in hanging drop preparation. In cases of severe dehydration, the blood urea nitrogen and serum creatinine will be elevated. Arterial blood gas analysis will show acidemia, and ECG findings can show sinus tachycardia or bradycardia, even prolongation of PR interval or flat T waves. We admit the patient and evaluate the degree of hypovolemia and start the oral rehydration therapy using the low osmolarity ORS, which has an osmolarity of 245 milliosmoles per liter. Now, mild to moderate dehydration resolves on its own on just ORS supportive therapy within 3 to 7 days. This low osmolarity ORS is favored for all types of diarrhea. In severe cases of dehydration, we may need to consider intravenous fluids and electrolytes like ringer lactate with potassium and sodium bicarbonate. In severe forms, we may require on an average 200 to 300 ml per kg of isotonic fluids in the first 24 hours, along with antibiotics depending on the stool culture and microscopy. Most effective antibiotics are tetracyclines, cotrimoxazole, doxycycline, erythromycin, azithromycin, and ciprofloxacin. Increased frequency of vomiting can be controlled with granisetron, ondansetron, and metoclopramide, which are antiemetics. In case of children, zinc supplementation may be helpful in reducing the severity of diarrhea. Also, and especially in children, anti-motility agents alone, like loperamide, may not be beneficial because they lead to stagnation of the intestinal contents where the Vibrio or any other organism continues to multiply. Hence, it is better to use these anti-motility agents along with antibiotics. Now, coming back to the case that we were talking about, ORS supportive therapy with a 3-day antibiotic course was the treatment given to the patient. Vibrio cholerae spreads via the feco-oral route. The incubation period varies from less than 24 hours to a maximum of 5 days. Stools have an appearance of typical rice water, that is clear water with flecks of mucus. Vomiting may be absent in some cases. Signs of severe dehydration include cold, clammy, and wrinkled skin, which is typical washerwoman type of skin. The blood pressure drops and the pulse becomes rapid and thready. Loss of several liters of isotonic fluid can also lead to profound shock. Cholera sicca, a very severe form where the loss of fluid into the dilated bowel kills the patient even before the gastrointestinal symptoms could appear. Once the contaminated food or water is ingested, Vibrios face their first barrier, that is gastric acidity, which is effective against small doses of Vibrio as they are highly susceptible to acidic pH. Hence they are cultured in alkaline medium. But once they cross this barrier, they reach the intestines. In the intestines, they cross the mucus layer, that is the protective layer of the intestines, by secreting mucinase, other proteolytic enzymes, and by showing the properties of chemotaxis and motility. The adhesion to the epithelial cells is then facilitated by a special fimbria, such as the toxin co-regulated pilus. Now, once there is adhesion between the epithelial cell and the Vibrio, they remain attached throughout the course of infection. But they never invade the epithelium, which means that the changes that are going to get induced are going to be biochemical in nature rather than histological. Now, the Vibrios which are multiplying on the intestinal lumen secrete a very potent toxin, which is the cholera toxin. It is far more potent than the heat labile toxin of Escherichia coli. This cholera toxin inhibits the sodium chloride pump in the intestinal wall, which leads to an excess of sodium and chloride in the intestinal lumen, which disrupts the osmotic balance between the intestines and the surrounding tissues. As a result of which, the water, bicarbonate and potassium ions rush into the lumen of intestines. The Vibrios also possess a lipopolysaccharide O antigen like in gram-negative intestinal bacilli, but this antigen does not have any role in its pathogenesis, but it helps in the immunity induced by the killed vaccines of cholera. The prevention of cholera essentially requires provision of protected water supply and improvement in the environmental sanitation. But as these are not easily attainable, vaccination even today continues to be the most widely used method of prevention in endemic regions. So guys, that's it. I hope that you liked the video and it adds up to your knowledge about the Vibrio cholerae infection. Thank you.